Assalamu alaikum students. In this lesson, I will discuss about cardiovascular diseases and related disorders. The diseases that involve the heart or blood vessels are collectively called cardiovascular disorders. These diseases have similar causes, mechanisms, and treatments. It has been estimated that cardiovascular disorders are the major cause of sudden, non-accidental deaths in developed as well as developing countries. The risk factors that lead to cardiovascular disorders include advanced age, diabetes, high blood concentration of low density lipids, for example, cholesterol and triglycerides, tobacco smoking, hypertension, obesity, and sedentary lifestyle. Atherosclerosis and arteriosclerosis are the diseases of arteries. These diseases also lead to heart diseases. Atherosclerosis is commonly referred to as narrowing of arteries. It is chronic disease in which there is accumulation of fatty materials, that is cholesterol or fibrin, in arteries. When this condition is severe, arteries can no longer expand and contract properly, and blood moves through them with difficulty. Accumulation of cholesterol is the prime contributor to the atherosclerosis. It results in the formation of multiple deposits called plaques within arteries. Plaques can form blood clots called thrombus within arteries. If this thrombus dislodges and becomes freely floating, it is called embolus. Arteriosclerosis. It is a general term describing any hardening of arteries. It occurs when calcium is deposited in the wall of arteries. It can happen when atherosclerosis is severe. Now I will discuss about myocardial infarction. This term myocardial infarction is derived from myocardium. Myocardium means heart muscle and infarction means tissue death. It is more commonly known as heart attack. It occurs when blood supply to a part of heart is interrupted and leads to the death of heart muscles. Heart attack may be caused by blood clot in the coronary artery. So here is blood clot. It is a medical emergency and the leading cause of death for both men and women all over the world. Severe chest pain is the most common symptom of myocardial infarction and may be in the form of sensation of tightness, pressure, or squeezing. Pain radiates most often to the left arm but may also radiate to lower jaw, neck, right arm, and back. Loss of consciousness and even sudden death can occur in myocardial infarction. Approximately one-fourth of all myocardial infarctions are silent, which means without chest pain or other symptoms. A silent heart attack is more common in the elderly, in patients with diabetes mellitus, and after transplantation. Immediate treatment for suspected acute myocardial infarction includes oxygen supply, aspirin, and sublingual tablet of glycerol trinitrate. Most causes of myocardial infarction are treated with angioplasty, which means mechanical widening of a narrowed or totally obstructed blood vessel, or bypass surgery. It is a surgery in which arteries or veins from elsewhere in the patient's body are grafted to the coronary arteries to improve blood supply to heart muscles. Now I will discuss about angina pectoris, which is a sudden intense pain in the chest. It is not as severe as heart attack. The pain may occur in heart and often in left arm and shoulder. It is a warning sign that blood supply to heart muscles is not sufficient, but shortage is not enough to cause tissue death. World Heart Day is held on 28th September every year throughout the world. Its objective is to help people better understand their personal risks of cardiovascular disorders. Cardiovascular disorders are the cause of 12% of adult deaths in Pakistan. There are over 12 million hypertension patients in Pakistan. About 10% of our population is diabetic. According to the World Health Organization in Pakistan, 1 in 7 urban adults is obese. That was all about cardiovascular disorders. Thank you and have a nice day.